Ozempic can work too well. Normal BMI on Ozempic does not always mean the safest result. If your body mass index or BMI is already normal, more weight loss is not automatically more health. A normal BMI label does not mean everything is safe. The real question is whether your body is still being protected as weight keeps falling during treatment and daily life. Normal BMI sounds reassuring, but it can hide a problem. That number means weight adjusted for height, and a healthy adult range is usually 18.5 to under 25. It does not measure muscle, hydration, nutrition, or side effects. For some people, Ozempic, whose ingredient is semaglutide, is used for type 2 diabetes. Others use it off-label for weight loss, meaning outside its approved use. Wegovy is the weight management brand for the same ingredient. Either way, the goal can change from health to shrinking. It works by copying a gut signal that reduces appetite. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. The same gut signal can help insulin release and slow how fast your stomach empties. Those effects can help treatment, but they can also make normal eating harder. That is where BMI can mislead you. A normal BMI is not automatically unsafe. A person at BMI 24 may have poor intake, weakness, and nausea. That can be less safe than BMI 27 with stable meals and good function. The safety issue is not the label alone. That is why the pattern matters more than one number. Doctors look at the reason for the medication, the speed of weight loss, symptoms, blood sugar, appetite, and daily function. A normal BMI with stable meals is different from a normal BMI with continued weight loss. The first warning sign is not thinness, it is when the weight loss pace starts controlling you. If each month brings less appetite, smaller meals, and more fear of eating, pause. The medication may be pushing harder than your body can tolerate. A tiny meal can feel satisfying on Ozempic, but that does not prove it contains enough protein, fluids, vitamins, or minerals. Feeling full does not always mean your body got enough nutrition. Another warning sign is trouble doing normal activities. If stairs feel harder, your legs feel weaker, or workouts suddenly collapse, think about lean mass. Lean mass means muscle and body tissue that is not fat. Losing fat can help health. Losing too much muscle can reduce strength. This is especially important for older adults. Muscle helps with balance, walking, recovery from illness, and staying independent. A weight loss photo may look successful. The same person can quietly become weaker in daily life. Symptoms and strength matter first, but blood tests can add context. A doctor or clinician may check blood sugar, kidney function, and electrolytes. They may also check blood test signs of poor nutrition. Electrolytes are minerals like sodium and potassium. They help muscles, nerves, and fluid levels in your body work safely. After the physical signs, there is a harder pattern to notice. Some people do not fear excess weight anymore. They fear stopping the drug. The body may be healthier than before, but the person may keep wanting a lower weight. That is when treatment can slide into chasing a smaller body instead of better health. This does not mean everyone at normal BMI must stop immediately. It means you and your doctor should say the goal clearly. The key question is whether you are treating diabetes, maintaining weight, or chasing a smaller number. For type 2 diabetes, blood sugar can be the main reason for treatment. Blood sugar means the amount of glucose circulating in the blood. If Ozempic is controlling diabetes well, a sudden stop may not be the answer. The doctor may consider dose adjustment or another plan. Medication combinations matter for people taking Ozempic for diabetes. Insulin and sulfonylureas can lower blood sugar directly. Sulfonylureas are diabetes pills that push the pancreas to release insulin. When appetite and food intake drop, these drugs can increase low blood sugar risk. For weight loss alone, the question changes. The goal is not treating blood sugar. The goal is deciding whether more weight loss still improves health or starts creating new risk. So a normal BMI should change the plan. The question becomes, keeping the result, not pushing for faster loss. Maintenance means keeping health gains and avoiding poor nutrition, muscle loss, dehydration, and a cycle of losing, stopping, regaining, and panicking. After weight reaches the normal range, ask whether the current dose still fits your weight, appetite, and symptoms. A dose that made sense at BMI 34 may not make sense after a different body weight. The plan should follow the current risk, not the old starting point. A safer review starts by looking at the weight trend. How much weight did you lose over the last 3 months? How much did you lose this month? Weight staying about the same is different from weight that keeps dropping after the original target has passed. Then review symptoms. Start with repeated vomiting, severe nausea, fainting, or dizziness on standing. Also notice dehydration, painful constipation, or inability to eat normal meals. These are not signs of discipline. They are signs that the treatment may need adjustment. Physical symptoms are not the only safety issue. If there is a history of an eating disorder, extra caution is needed. An eating disorder is a medical condition involving harmful patterns around food, weight, or body image. Reduced appetite can feel helpful, but it may make harmful food restriction feel easier. What family notices can also matter. A patient may notice the smaller waist first. A spouse may notice exhaustion, skipped meals, irritability, or social withdrawal. Those details can reveal risk before the blood tests look dramatic. Set a lower safety limit, not only a goal. This means the weight, symptom pattern, or nutrition problem where the plan must be reassessed. Continued loss, repeated vomiting, or new weakness should trigger a call before another dose. Use a simple home check before the next dose decision. Can you eat regular protein, drink enough fluids, function through the day, and accept a stable weight? If several answers are no, the number on the scale is not the main issue. Normal BMI plus continuing weight loss means the next dose decision should not be automatic. Poor intake, weakness, fear of eating more, or repeated side effects also matter. That is the time to contact the doctor or clinician who prescribed it before increasing the dose. Do not make the decision only from clothing size. Bring useful data to your next scheduled medical visit. Include starting weight, current weight, appetite, side effects, relevant blood sugars, and a normal day of eating. The doctor may discuss staying at the same dose, lowering it, changing diabetes medication, nutrition help, or a maintenance target. The right answer depends on treatment reason, blood tests, symptoms, and history. It should not come from a social media photo. A normal BMI is not dangerous by itself. The concern is normal BMI plus continued loss, poor intake, weakness, side effects, or abnormal blood sugar readings. That combination should change the plan from losing more to protecting health. Remember this. The goal is not to become smaller at any cost. The goal is to live better in your body. If weight keeps dropping after health has been reached, the plan needs rechecking. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.